Hello everybody, and thank you for joining us for this, our Digital First Providers Guide. In a few seconds I'm going to be bringing on our presenters, and in terms of going through basically what is Digital First Primary Care. In addition, we're going to be showcasing some of the providers that offer mechanisms like online consultations to many of you already, share what they're able to provide for you, and then we're going to go through some questions that have already been pre-submitted to answer your questions that you've been able to submit, and then give you the opportunity to ask questions yourself. This is a live demonstration, so first of all, apologies for getting any gaffes and stuff, but secondly, this is also your opportunity to ask questions live as well. All those questions we will take at the end, so stick them down in the comments. Feel free to ask whatever you want. We'll try our best to answer them towards the end of the session. However, I'd like to bring on our first presenter, and I'm proud and welcome to introduce Dr. Minal Bakhai to the stream.
Hi, hopefully you can hear me.
Yeah.
Thank you very much for having me. So hi, I'm Minal. I'm a GP in Brent in Northwest London and Deputy Director and Clinical Lead for Digital First Primary Care in NHSE and I. And so
yeah, go for it, Minal. So Minal's just
Sorry.
basically going to share with some of the work that NHS England have been doing, and particularly with obviously COVID and everything that's happened. Many practices have jumped onto using concepts like digital first primary care and total triage. I think you're going to explain what those are and some of the work that NHS England's been doing to support practices, aren't you?
Yes, so I thought I would share with you results of a survey that we did a month or so ago, asking practices and practice managers, practice staff about the challenges that they had faced with the online and video consultation systems that were currently in place in response to COVID and what they would like to see in these systems going forwards. So I guess perhaps just to set the scene, there has been a huge acceleration in the uptake of online and video consultations during the pandemic. We have just over 90% of practices live with an online consultation solution compared to pre-COVID, where that was about 30%, and 99% of practices live with a video consultation solution. And pre-COVID, that was about 3%. So that's a huge acceleration and, great innovation from general practice. And I think what we need to now look at is how do we make these solutions sustainable. So there is something about using digital consultations in response to a crisis. And I think we've heard very clearly from the profession, recent BMA survey showed that 9 out of 10 GPs didn't want to go back to just the traditional model of care. They wanted to have the options, the flexibility to use these other modalities where they were appropriate, so the right tools for the right person. But how do we make use of this technology more sustainable? So I'm just going to attempt to share my screen. And hopefully you can see some slides up on your screen that I'm just going to take us through very briefly in terms of the survey results. And so what we did was we put together a short survey and asked general practice for their response. And so we had 138 responses over a couple of weeks. The majority of responses were from GPs, but there were some practice managers and other members of practice staff. And of those that responded, 81% at the time were using online consultations and 97% were using video consultations. And on the left-hand side, you can see the list of suppliers that practices were using either to provide their online or video consultation solution. And there's quite a range there. And in terms of challenges, so I've just listed really the top 5 challenges, or top 6 in this case, challenges that people were facing with their systems. So in terms of an online consultation system, the main issue, was integration with the clinical system. Now, we know that this has been a long-standing issue, perhaps not just for online and video consultation systems, but for other systems as well. And in the short term, nationally, there's been a lot of work to try and improve the integration between online and video consultation solutions and the clinical systems. And NHS Digital currently are assessing solutions for improving overall integration with the main clinical system suppliers, and hopefully there should be some good news coming in the next couple of weeks on some of those options that they've explored. But in the longer term, the GP Connect service is being developed to provide greater integration between these systems, so read and write back and structured coded data coming into the clinical systems. They're just completing their discovery phase of this work, following which we will have more definitive timelines around how long that will take. The second biggest challenge was implementing change at a practice level, and I think, you know, the technology in a way is the easy bit, and this is not about just deploying technology. This is about changing workflows and processes, and we know that the effort required to do that should not be underestimated. And as part of the COVID response, implementation or additional implementation support was provided or set up for practices and PCNs to access via their CSUs, AHSNs, CCGs, and regional teams. And that support came from a range of different experts, including time for care, analytics support, and national teams. This support should and must continue, but is going to be planned and coordinated at a health system level, because that makes much more sense to ensure that it meets local needs. And the Digital First Primary Care funding, which is released to regions to give to their systems, must be used to ensure that adequate implementation support is provided and resourced for practices and PCNs to optimise use of these digital solutions and work through the change processes that need to be made to support more effective working. And those plans and design around that support offer must be developed with practices, with PCNs, with some patients or patient representatives and LMCs to ensure and agree that local priorities and areas that require most support are covered. And so any practices on this webinar that need support and haven't managed to access it, please contact your CCG. And if that's you're not getting anywhere, then there's an email address that I will show at the end of this that hopefully Hussein can circulate, and we will put you in contact with your regional team so that you do get the support you need. The next challenge was trying to encourage patients to use it, because it is a new way of accessing services. There was a national campaign called Health at Home that was set up in response to COVID to provide generic information to patients about these new ways of accessing services, and videos around how to use an online consultation, how to use a video consultation. I think what we're hearing is that patients also want some more sort of bespoke information, or practices want some more bespoke information around the product that they are specifically using to help patients feel more familiar with it. And feel more confident in using it, and also some clarity around what to expect. There will be a national campaign, a much bigger national campaign over the next few months as well, supporting that. IT infrastructure was a big issue that came out, so not having the right equipment or the Wi-Fi connectivity in a practice setting. And I think that is something that's it's well known, and the NHS Digital and NHSX team are working through some of those barriers or challenges, and perhaps that is something for another webinar to invite those teams on to discuss the progress that they're making to support practices on that front. And then the final two were adequate information capture from the system. So some respondents felt that they weren't the system they were using wasn't capturing enough information for them to make decisions, and also linked to the interoperability or integration, the manual burden of some of the online systems. In terms of video consultation systems, very clearly the challenges were centered around infrastructure both from the patient side and the practice side, as well as digital literacy. And there is lots of work, actually, a big focus on health inequalities nationally, and digital inclusion is part of that, looking at providing better connectivity for those that don't have access to devices in the community. For example, building on the work of the Good Things Foundation and community hubs, employing or digital champions, or training up digital champions to support patients, trying to develop awareness within communities, and engaging materials in other languages that aren't English to make sure that awareness is raised, plus a whole host of other factors that I'm sure we'll come on to, particularly around the usability of the current solutions. And so key developments that respondents wanted to see, particularly in these systems. So we've talked about integration. They want to see better signposting, filtering and flagging functions within the online consultation systems to help manage their workflow more efficiently. They wanted to be able to customize the online forms. There was a lot of comments around the usability of the online forms. Some felt they were too long for patients, or the drop-off rate was high, or patients were saying that they didn't like it or felt that they were very repetitive, and also better or seamless messaging functionality. In terms of video consultations, again, people want to see integration, but also one-click functionality so they could switch modalities easily. They wanted more bespoke patient user support, improved quality of the video, and also multifunctional video solutions, so that they could work not just for one-to-one but one-to-many, so video group consultations, care home ward rounds, MDTs. They could support a range of functionality in one product. So I'm just going to stop there and stop sharing my screen. Hopefully that's worked.
No, that's worked perfectly, and thank you for that, Minal. So I know that now we're going to hand over to the various providers that we've got, and we've been fortunate to have 6 different providers that have been able to attend and show us what effectively they've been doing to try and help practices in terms of manage everything that you've just mentioned in terms of access for patients and practices in terms of using digital first primary care. We've got 6 providers in total, so that's AccuRx, AskMyGP, eConsult, Engage Consult, Klinik Healthcare and TPP SystmOne. We did have more that wanted to come on, but unfortunately my system doesn't allow for more people, I'm afraid, and this is maybe something that we can run again in the future if people are interested. So I will point out they've all been given a very strict deadline, so I apologise if they do not and are not able to answer all your questions in the time that they have. We have got mechanisms to try and give you more access to information, and I apologise that I've made them stick to a very tight time frame. So I'm going to apologise for them on that behalf. In addition, I'm going to be on screen keeping time just to try and make sure we can get to the questions that are coming up later on. So first of all, I'm going to invite Lucy from AccuRx to come on the screen and take over for us. Away you go, Lucy.
Hello, everybody. Thanks for having me. I'm just going to share my screen. I'm Dr. Lucy Marples. I'm one of the clinical leads here at AccuRx. I'm here to introduce patient triage. We're very excited about it. It's our answer to online consultations. Since AccuRx started in 2016, we are now in the daily workflows of 99% of GP practices. And I think part of the reason that we've got there is at the core of how we work is we listen very closely to our users. We work quickly to create and improve on products they tell us that they want. So with regards to online consultations, we've been speaking to users up and down the country and doing remote testing with patients. And the overarching message that we've got is that clinicians, practice staff and patients want online consultations to be simple, so quick and easy to use. Important to practices is that it integrates with the electronic patient record. So 5 weeks ago, we launched our beta version of patient triage, and that's live in a small number of practices. So we've been working with them to find out how they're using it, what they want, what improvements they want, and we've been making those improvements week by week, and we'll continue to do so as we go. So you can see here, it's going really well. The graph is going up. More and more requests are coming in, and we've had fantastic feedback from practices and from patients alike. Anybody can try patient triage for free if they want to, with no obligation. We've got a few hundred practice sign-ups to try imminently, so just go to either our website or to the link down here. So I'll show you what it actually looks like on a one of the beta practice sites. So you can see there's a link to it here. We'll provide the URL behind this. The patient will click on it and it will open up a web page like this. So very quick and easy to use, no app, no need to create an account, nothing like that. And the patient can do one of three things. So they can seek online self-help advice, submit an admin query, or submit a medical issue query. So I'll show you a medical issue. The patient, the patient will first have to, I'm not sure what's happening here, sorry. This is a demo. Here we go. So the patient first has to say that they don't have any red flag symptoms, otherwise they can't continue, and then complete a quick COVID screener. And then they're through to the medical questions. So this is all the questions they're asked. It's very short and sweet for the patient to submit, but it's designed so that it's enough information that the practice can tell, does this patient need an appointment? If so, with whom, within what time frame, and via what medium? So what is the medical problem? How long has it been going on? And is it getting better or worse? A couple of icy questions. So is there anything you're particularly worried about? And how would you like us to help? And how quickly do you think you need a response? And are there any times we can't contact you? Interestingly, less than 10% of patients ask for a same day response, which suggests they understand it's not for urgent requests, which is great. The patient then puts in their contact details. And we had a 98-year-old gentleman submit a request with no help a couple of weeks ago, according to one of the practices, which is lovely. It implies it's working well and it's easy to use. They'll then they're prompted to put in a mobile number preferentially, because if they do, we can verify who they are via two-factor authentication, so via an SMS code texted to them. I won't show that for now in the interest of time. Here is the summary of the patient's request. They can answer how they would like to be contacted, and there's a box here to promote continuity of care. And that's it, I've submitted my request. In terms of how it comes into the practice, for the next couple of weeks, it's coming in to the practice email inbox, but in a couple of weeks, we're excited to be integrating with SystmOne and EMIS, which means crucially the messages can be saved directly into the patient's record. So I'll show you how. They'll come into the familiar AccuRx toolbar here. They'll come into the to assign folder and you can see the request sitting here. So I'll show you one, you can see who it's from, and it's very quick and easy to see what the request is about. And here I'm going to save it to the record with one click. There you go. And now it's sitting in EMIS. It's got an online consultation coding there. And I can go back and mark this as done. Boom. For the next request, I'm going to show you quickly that I can assign it to a particular team or a particular person. So it's now sitting in the admin team folders. And for this request, so even though we do a red flag screener, some requests that require more urgent attention might come in. So we've got the ability here to mark the request as urgent, which turns it red, shoots it to the top of the inbox, and then that's done. And then you can respond to the patient via the usual AccuRx suite of features, so SMS, video call, etc. So what we're working on at the moment in the next couple of weeks, we're very excited about. We're continuing to improve. So things on the horizon are the ability for the patient to attach pictures or documents, the ability to submit the request on behalf of somebody else, and some degree of customization at the practice level. So, for example, practice can choose whether they reply within 1 working day or 2 working days, because everyone's managing to do it within 1 working day. So sign it's all working really well.
Thank you for that, Lucy. As I said, apologies to everyone. I know I've asked them to rush to deliver this kind of presentations for everyone. So we're going to take questions at the end. So I'm going to ask Lucy to come off the stream if that's all right. And I'm going to bring on Harry from AskMyGP. And Harry, if you need to share your screen, go for it. And there we go. And we're off again. Right, Harry, we can't hear you. Apologies, we're still not hearing you, Harry.
I'm not muted.
There we go. We've got you now.
I'm not muted. Okay. So the starting point is understanding demand, because we're looking at the whole of demand here. And actually what we're doing is being able to respond in a demand-led way. So the old idea of filling clinical slots, it turns out to be limited. Actually, what we need to do is understand how we can respond to patient needs. And the key bit being that the GP decides how to help, whether that's telephone, face-to-face, message, can be video, although that's 0.5%, it's quite small. What we're looking at here is a system for managing the whole of the practice. We begin with the patient demand, whether that's online or telephone. Then it's assigned to a person, be it GP, another clinician, admin person. So they can then decide what to do. So it's the humans who are doing the assigning and the triage. Key thing being to move the patients by making it really, really simple. So they can ask online or by phone, this is crucial. It's the GP who's doing the human triage, and it will be a very rapid response. And we can look at some of the data later.
Harry, I'm afraid we've lost your audio again. Apologies, everyone. We seem to have lost Harry's audio, and I'm not quite sure I can get it back. Everything does seem to be working. It's just not coming through for some weird reason. I think what I'll do, Harry, apologies for this. I'm going to take you off whilst we try and figure that out in the background. I'm going to go to next up, which is eConsult. So that would be Bala. If you could start your screen share, Bala, and then we'll get started, and I'll see what I can do to help Harry in the meantime. There you go.
Are you seeing the screen now?
Yep.
Brilliant. Okay. Hi, everybody. I'm Dr. Balachandran, known as Bala. I'm the Chief Medical Officer for eConsult, and I'm also a practicing GP, one of the founding members. Just a very brief history through time. We've been established almost 10 years ago, and we're a clinically led organisation started within a London partnership called the Hurley Group, and we look at taking structured histories online for remote management and remote closure of patients who submit through that form. So we started in 2011, and just notably on the timeline, you can see in 2017 we set up the first eHub, and there's a lot of interest nationally, especially with PCNs, around federated working for online consultation. In 2018 we went into urgent care, and we've got an e-triage product that's now deployed also at 2 A&E departments. And then in 2020, we're now integrated, we're the first provider to be integrated within the NHS app and provide NHS login functionality on our platform. Today, we're now live in over 3,000 practices, so we're the largest online consultation provider serving 25 million, and that's across the UK. Just a bit about clinical safety. I know it's very slide heavy, but we take clinical safety very seriously. We've got a lot of red flagging questions because our platform's on 24/7. You've got someone submitting over the weekend. It's important that, you know, if it's an urgent problem, that they're signposted accordingly. So we have our own in-house clinical developers. We own the clinical content, and therefore we can change it. We also have a clinical governance board consisting of 26 UK clinicians that peer review our content. We conform to DCB 0129 and 0160 standards. So in terms of the patient journey, either the patient can start on the practice website and there's a window to go into the eConsult portal, or as I mentioned before, they can start the journey via the NHS app. And essentially they're presented with four options. Either they they're consulting about a particular condition. Say, for example, they think they have a urinary tract infection. They may have a collection of symptoms, in which case they can use the general advice, which takes a symptom-based history. They've got the admin option for requesting sort of sick notes and GP letters and things, and also a paediatric consult. They can select from a number of conditions. There's an A to Z listing as well, and the search functionality as well. So I've picked anxiety as an example here. Initially, they're served up choices for self-help, and we have syndicated choices from content from NHS.uk. We've got pharmacy advice, and also local services that are configurable via CCG, things like IAP services, self-referral services that we can signpost to. And the fourth option below is where they can actually start an online consultation with the GP. So there's some initial disclaimers and some advisory about COVID at the moment, and then we make sure that there's no medical emergencies before starting the journey. And then we start off with an open-ended question, which is what we do really in general practice as well. So it allows the patient to put in their own words what the problem is. Now, I'm just going to demonstrate some of the safety even in our free text boxes. So I've been very provocative for this demo and said, actually, I feel like killing myself in this anxiety template. And immediately the system detects that within the free text, asks the question directly about suicidal ideation, and if confirmed yes, we stop the patient, we ask them to seek urgent advice. Otherwise, if they haven't triggered any red flag, they'll continue with the process, and we ask about sort of what treatment they're particularly after, any particular doctor that they may want for continuity of care, and then we take a structured history. And it's the detail of the structured history that clinicians really find useful to help remote close the consultation. So we ask things about symptom duration, GAD-7 score questions, if they put depression symptoms in, PHQ-9, etc., etc. And some social questions as well. So when they complete that, the patient gets confirmation. We have an orange window here that basically shows if for worsening care advice, if their problem escalates, to seek urgent advice. This is an example of an eConsult report that the practice receives, and you can see we populate the PHQ-9 GAD-7 scores, and then we provide a very detailed history of what the patient has provided, breakdown of the PHQ-9 GAD-7 scores, etc., etc. So in summary, basically, patients can have self-help options. Otherwise, when the online consultations come through, the practice team could be used in looking at the online consultations, and some of these can be remotely closed, either via prescription advice, phone, video, or face-to-face as deemed appropriate. We support different models, including total triage, same day, and even routine, so we're very flexible for the practices. Also, we have long-term condition templates as well for chronic disease management, and these are the sort of templates that we use for our long-term condition content as well. So that's it in a nutshell in my 5 minutes. I hope you've all found that useful.
And I believe that was a Herculean task trying to get through 28 slides in 5 minutes. Definitely not the way to present, but thank you, Bella, for that. We're going to move on to the next person in our list. So that's Engage Consult. So let's just swap things around, and we're joined by Chris. If you can start your screen share as well, get your slides up and things, and hand over to Chris from Engage Consult.
Okay, can you see my slides, everyone?
Yep, your slides are up, and we can hear you as well.
Okay, well, thanks everyone. So as of today, we have 432 practices using Engage Consult, serving around about 4 million or so patients. We offer true online consultations. So what I mean by that is Consult is a single platform for both secure messaging to patients and video consultations. We fully support total triage and inter-organizational working. We integrate seamlessly with all leading clinical systems, and we're very pleased to say that we'll be going live with our NHS app integration on the 23rd of August. Engage Consult is highly customizable, so you can configure exactly the service you want to deliver. So this includes communicating clearly how, when, and who will respond. You can write your own ideas, concerns, and expectations questions, and you can add links to other local services as you require. So Engage Consult uses structured questionnaires. They deploy branching logic over a database of 76,000 questions. So the whole breadth of medicine is covered. And the core question asking engine, IMH, has been in use for over 23 years and currently supports hundreds and thousands of consultations a day worldwide. So questions posed depend on answers given. So no two questions are ever the same. And a detailed but easy to read narrative style report is then sent to the practice. We have an alert system in response to concerning symptoms, and these indicate when a more urgent course of action might be appropriate. But what we don't do is stop patients consulting. We provide information to help them make their choice. So messages are sent to a common inbox in the practice workflow, which is linked to the clinical system, and it's highly configurable. So you can create your own workflow groups, and you can share these with other organizations. Staff cover the work groups as required, and that means they can see and action messages, and they can cover for their colleagues too. So when you open a message, it triggers an automatic search and match for a patient in the clinical system with the same demographics. However, the steps you take to verify the patient remain your decision. But you can communicate with a patient if they've been matched online, and you can use this channel to ask them questions that only they could reasonably answer to verify their identity. And we've got canned responses that can make this very simple. Okay, so when a message arrives in the workflow, it can be assigned to colleagues or a practice configure work group, or as I've said, to other organizations. And again, as I've said already, we have customizable canned responses. And also you have the capability of attaching documents to a message that's a reply to a patient. When they get their message, they're alerted by email, and they log into their account portal to read and respond to their secure message. But importantly, patients can't send further messages. They've got to wait for a response. So you are actually always in control of your patient comms channel. We have ad hoc video now, and we will be offering video appointments very soon. And importantly, the clinician remains within the workflow environment to conduct the video consultation. Okay, so when the consultation episode's concluded, the symptom history report and all associated communications with the patient and actions are placed in the record as an attachment with a note. And the information is placed in the record at a simple click of a button. And this is a screenshot of an Engage Consult episode in EMIS Web Consultations, and it's displayed in exactly the same way in the SystmOne journal or the Consultations Manager. And all episodes are coded in the PCS, so they can be searched for and reported on at a later date. Okay, so let's have a quick look at the roadmap. Coming very shortly, as I've already said, are video appointments, and importantly, they will be using the clinical systems appointment book. We'll also have multi-point video consultations, so you can consult with a patient and have a translator, for example, or a patient advocate support them remotely in the same video consultation. Looking further at total triage, well, we'll shortly be providing a means to indicate a triage priority score for each message. And then we'll also have easy filtering of messages to support this triage workflow. So that will be by triage priority, time in the system, and individual patient history. And this is really exciting. We think care homes will be able to log messages for their residents directly into the practice workflow and use inter-organizational working to be able to actually assign messages directly to the relevant team at the practice or elsewhere in the PCN. And looking at outbound messaging, very shortly, practices will be able to actually initiate an outbound message as well as replying to a consultation request. So they'll be able to invite patients to give post-consultation follow-up information, gather information to support LTC treatment planning, and also QOF-related information using coded templates, inform patients when actions have been completed or of either local or national NHS campaigns. And then finally, looking further out, looking at reporting, organizations will be able to log into their own dashboard to generate reports on any subset or all the practice that they may have a defined executive responsibility for. So that will mean this will be for CCGs, PCNs, and even STPs. Trend reporting is going to be a key thing we're going to be offering in the future. And we're also looking forward to working with organizations really to better understand what type of self-service reporting they'll wish to access in the future. And I think I've probably just stayed within my 5 minutes. So
smidge over, but I'll allow it. That's fine. Thank you for that, Chris. And thank you. I know it's a lot to get through. I know we've got loads of questions in the chat. I know we've also got people supporting us trying to answer them, and a lot of your questions hopefully will be answered in the questions phase that we've got coming up. So next up, I'm going to invite Ben from Klinik, who's going to come onto the stream. And if you can start your screen share as well, Ben.
Yeah, no. They want from. Can you see that?
There we go. Yep, I can.
Okay,
Thank
good
you.
afternoon,
And
everyone.
it's all yours.
Good afternoon, everyone. I hope you're well. Our title slide pretty much tells you what we want to help you with to ensure you see the right person at the right time and ensure you can effectively redirect patients to the relevant points of care. Just a little bit about ourselves. We're an online consultation and crucially a demand management system. We were established in 2013 in Finland by a core team of doctors and engineers with leading expertise on how patient pathways should be arranged in order to deliver high quality care and cost-effective processes. 2 of our 6 founders are also computer scientists and have combined their medical expertise with computer science knowledge to build our algorithm. We have also a team of engineers and user experience designers. The user experience is key to our success because we understand that patients and healthcare professionals to buy in and adopt new systems, systems must be intuitive and user-friendly. With that said, we currently have product being adopted in over 475 healthcare centres in Finland and the UK and cover about 2 million people or patients have access to our technology. In the UK, we have implemented into single-sited GP practices, multi-sited GP practices, and GP federations. The implementation of Klinik, with the implementation of a Klinik, our goal is to put you in control of your patient flow so time and resource can be optimized. So the 4 key elements to our solution is an intuitive total triage platform handling clinical and non-clinical inquiries that come through online, over the telephone and through walk-ins. Secondly, Klinik's medical AI engine automatically recognises over 1,000 symptoms and conditions and can identify the primary healthcare issue and recognise its urgency. Number 3, with this information, your staff can use the patient flow management system to effectively collaborate and redirect patients effectively. Number 4, dashboards. We can present all inbound data, whether it comes through online, over the telephone or walk-ins. And this information its data is from frequent users to information around prevalence, etc. It also helps you deal with admin inquiries much more efficiently and identifies inquiries that are suitable for self-care, leaving the GP with a smaller volume of patients. Please note that the urgency indication is only visible to the practice staff, but currently we are monitoring suggestions for self-care and are developing a module that can provide the suggestion for self-care directly to the patient, which will further reduce the pressure on your practice. This is how the system works in practice. Please note that the solution is set up and configured to your practice or PCN requirements. This is not an off-the-shelf product. At Klinik, we work and support customers to deliver a solution that fits their specific needs. We also support practices ongoing post-go live with regular catch-ups and review calls. I wanted to briefly share with you why our customers choose to work with us. The main 4 drivers are 1, user experience, which helps staff focus on who needs care first, which results in a significant reduction of admin time. Number 2, we help refine and reform how patient flow is managed. Number 3, the dashboards. As for the first time, it gives you the whole practice team visibility of the flow and the type of demand. And finally, 4, the value that is created because the time Klinik system helps save. This slide demonstrates some of the usage data we provide. Number 1, you can see the steady uptake of our solution. Very regularly, over 20% of patients prefer to go online within the first month of going live. And of course, number 2, patients who don't have access or the confidence to go online have the ability to submit an inquiry over the phone or walk in, and they still have the ability to use the phone lines. But all the data is collected in one system. You can also see that the utilization of the system is reported both for medical and admin inquiries. We have proven outcomes. In Finland, research shows that every inquiry that uses Klinik instead of the phone lines, there's a cost saving of around 14%, which in Finland equates to 31 euros per patient, or around £27, depending on the exchange rate. It also shows that the number of interactions or touch points within the practice is reduced when Klinik is used.
Thank you for that, Ben. I'm going to stop you there if that's all right. I know that you've got your details and stuff if people want to contact you for a demo, and we'll come back to all the providers towards the end when we open up to the questions section. At this point, I'd like to invite Kieran to come on from TPP SystmOne and show their options that we've got. Where we are. Sorry, there we go. And if you can start your screen share as well for me. Awesome. All yours, Kieran.
Okay, that's great. Thank you. Hi, I'm Kieran Fletcher-Vaughan from TPP. I want to start with a brief introduction of our AirMid application that we've recently released. So this was a few months ago. We put the AirMid app out there, and it's our new patient-facing application. Some of you might be familiar with SystmOne already. This is kind of a new version, and we'll sort of be moving people over to AirMid. It does all the stuff you'd expect of a patient-facing application. So you can book appointments, manage your medication, access your record, contact your clinician and your practice and stuff like that. But we've also got additional features, so the ability for a practice to push out published questionnaires and templates that they want the patients to complete. We've got integrated video consultations and things like wearable device integration. So it's kind of becoming a bigger beast than SystmOne ever was intended to be. But I just want to talk about one of our newer products now that's soon to be released, which is our online consultations platform. So we're currently in the process of configuring our content for this product. So it's not currently available, but the way it's going to work is there's going to be TPP published products, so content that we've decided to put out there and make available to you. But then that content can be customized by the practice, or it can actually, you could start completely on your own and create your own content, all in SystmOne, and then push that out to the users of the AirMid application. So it's up to you whether you want to sort of piggyback on the work we've done, or actually decide you want to create your own stuff completely. So it's completely customizable to your needs. And also, one of the things we've been touched on already, this then fully integrates back into the SystmOne patient record. What I'll do is I'll show you a quick video of that and talk over the top of it, and then I'll go through what the advantages of this solution are. So what you're seeing on the screen now is what this will look like to the patient. So an online consultation form will be pushed out to the patient who's using the TPP AirMid application. And this is just a real basic example of one that we've created. And again, it's stuff that you would be able to create yourself. So you can use a combination of things like single selection boxes, multiple selection, free text if you preferred that. So you could have a form full of 4 just free text boxes about tell us about the details of your condition, or you could have something that's a lot more specific, tailored to a specific condition where you want to drill in and ask the very specific questions. So one of the other things that the platform will allow you to do is to actually code the data that the patient's entering if you want to. So here you'll see a smoking question, and then the patient's entering some information about how many cigarettes they smoke. And what you'll see shortly when I show you the SystmOne side of things is how that then can be coded and added to the patient record. So this patient's just finishing their survey at the moment, and then they get a preview of how that's going to look. They can go back and edit any answers if they'd like to. But here they're just reviewing that, and then they're going to save that, and that's going to come into SystmOne. So then if you look at the sort of clinician side of it, it comes into SystmOne as a task. So a lot of you who use SystmOne will be familiar with the task screen already. And by actioning the task, you can see then the questions and the answers that the patient has provided. So you click through the different sections. And again, depending on how this form's been set up will depend on how it's presented to the user. On deciding to file that to the record, you will see a prompt about the codes that the patient's added in the background. And you can then choose to submit those to the record or not, depending on whether you think those are appropriate to be added to the record. So I'll just quickly run through what we think the advantages of this solution are. So obviously, one of the things that's been highlighted previously was the need to integrate with clinical systems. This is a seamless integration with SystmOne. So the patient, we already know who the patient is. the online consultation is already linked to the patient record. When it comes in as a task, that's seamlessly filed along with the stuff that we've shown you before. We've got that opportunity for automatic coding, which could help obviously with collecting data for QoF or anything else that you feel you need to collect the data for. The content is highly customizable. So like I've already touched on, you can use the TPP stuff that we will provide and make available to you. You can also create your own content from scratch or slightly tweak what we've done. Maybe you want to add a few extra questions or take some out. And then one thing we've not touched on just yet is the ability to sort those as they come into the task list. If we know that it's an admin task or something that needs to go to a specific person or team, we can use existing SystmOne functionality such as task rules to direct that to the right person in the team. So it would go to the right team basically and be picked up by the right people. And I think I'm just inside 5 minutes, and that's just about it.
In fact, you beat me to it there, Kieran. So yeah, definitely within your 5 minutes. So we're going to see if we can get Harry back on stream. So Harry, do you mind starting up your screen share? We'll give that a go again. So Harry from AskMyGP.
Hi. Hi, how's that? Is that working?
And we're up. Yep, perfectly. Let's go.
Okay. Brilliant. Okay, so what I'm going to do now is be a patient on a website. We do provide websites, or you can use your own. And I'm just going to say skin rash as my starting point. And the first thing is to try self-help. We know that 20% of patients will actually click the self-help and they go straight through very, very quickly. But to demo what happens, we won't do that. We'll just go back and say, I'd like to consult my GP. Now, I can be a patient or parent or carer. We get quite a lot of those. I've already created my login just for speed, but we'll say this is a new medical problem. I've got a skin rash. I'd like help from someone by name. So I'll click Ian Barrett. And that's a choice that's managed by the practice, who's in today, so that you can have a choice of GP. How long have you had this problem? 2 days. And describe your symptoms and an idea of the cause. Lots of scratching. I'll be fairly brief on this just to save time typing. Now I can attach a photo document. 70% of patients are actually on their mobile at this point, but I'll just be on the, I'll go hives, just click this picture, are on mobile, so they will usually attach direct from their mobile. And we get about 8–9%, so it's very, very popular. Interestingly, telephone is the most popular response requested, but email messages is second. Video is very small, about 0.5%, but you can see the patient has a free choice. They've done their bit now, and they've got their message that yes, we're open. Now I want to look at what happens inside the practice. So let's just go to the practice, and here we go. Here's Harry tested DP1. I've got that description of what I've got. I've got a photo, and I can load that up and take a look in more detail. Suggestion of who to assign it to, because they're starred, choice of GP. I'll send it to myself as a doctor instead, just so you can see what happens. And now when I move to my own task list, here is that request. I can check on the ID status. Normally, of course, you'd come in through NHS Spine verified, and then you'd have the NHS number. We know who you are, but I'm just going to manually verify this patient. Message to the patient to say, nice picture. You've got full two-way messaging with the patient. So the patient is now going to get that message. And what we can do also is we'll send an email to the patient, so they get they'll get an email alert, and we can then decide how to await reply, give them 3 minutes to reply. If I want to copy this into the EHR. I can do that now. I can download the picture, and I can now move on to my next request. Now, what happens also here is that I can manage the whole workflow. So this is my workflow, all of my clinicians, groups that they're in. I can see here what's coming new, what's been assigned, where we're waiting for a patient to reply, new and completed today. I can manage my GP's availability here, so I can set them to give them an availability time. They can go multi-site. We've got a lot of multi-site practices, so that you know where they are and what capacity they have. Remember, we're dealing with predictable capacity. So that's a quick spin round, and you can see there are reports in line as well. I think we're near the end now, so I hope that's good. And if we want to look at more data, we have that here on live.
Thank you for that, Harry. So thank you for that. Apologies everyone for the slight tech hitch we had. We're still not quite sure why that happened. What I'm going to do now is I'm actually going to bring on everybody onto the streams so that you can have the opportunity to ask questions. Before we do that though, we have already had some pre-submitted questions from several people beforehand, and so I know a lot of the chat has various of these questions involved as it is. To cover some of the quicker ones, what we've got here is just a slide that shows 4 questions that we've asked all the providers to submit answers for. So the first one is, do you provide integrated video consultations? And you can see the answers there. Secondly is, do you provide automated digital triage? And again, the answers are there. Then we asked a slightly more challenging question of, what's the average cost for your platform for a 10,000 patient practice population? And again, the answers are there. And then finally, we asked, what is your current patient drop-off rate in terms of patients engaging with the systems? And again, we have the answers. As you can see, for a few of the answers, there's little asterisks next to them. And that's because clearly to try and give the complete answer to that is hard to summarize on a single slide. So what we will offer you at the end is all the companies have provided more detailed answers, which you will get access to those at the end once we've completed the feedback forms. However, we did also ask some slightly deeper questions that are a bit too tricky to capture just on slides. So I'm going to pass over to Minal, who's going to introduce these parts, and I will bring them up on the screen as well. Interestingly, the first question was offered to us by Craig Nikolov. From many of you probably know him on Twitter as a PCN clinical director and supporter. So over to you, Minal. Oh, 1 second. There we go. Minal, you've chosen to mute yourself, so you have to unmute yourself.
Sorry, I was trying to respond to messages. I obviously can't multitask. So the first question, how do you support and ensure you do not leave the have-nots in society behind? So particularly those without mobile devices or the internet. So
if I can go first to AccuRx, so Lucy.
Yeah, thanks, Minal. I think the main benefit of our product Patient Triage is that it's incredibly simple to use, which means that the simple questions mean that one of the reception staff can fill in questions on behalf of a patient because it takes so little time. We're also working on making a reception flow for this a bit quicker and slicker. We're also working with the main network providers with the aim of making video calling free for patients so they won't be prohibited from video calls due to the cost of data.
Awesome. Harry?
I agree with Lucy, simplicity is important, but if people have no access to internet or online, they can phone. And one of our aims is to benefit non-users, because the users are saving the GP time and freeing up phone lines. So we've got 70% of demand in our practices coming online on average. That's over all the practices, some are a lot higher. Our average is 70%, and the 30% who are phoning in get better service because of the 70% who are online. And so there's no discrimination at all for the have-nots.
Okay. Bala from eConsult.
Yeah, absolutely. I mean, I agree with what Harry has said. I mean, there's inevitably, when you do this digital transformation, there are people who simply cannot access the internet or have mobile devices to do that. So we are creating a digital journey for patients, but the practices also do need to adapt. And I would argue that if you bring in people digitally, you're freeing up some capacity for the telephones that come through for the practices for them to take calls for people who can't access that. And what we've done to support practices, we provide clinical system templates to be able to capture information via templates that's similar to some of the structure of the eConsult, and that can be then on to a telephone triage or consultation list.
Thank you for that. We seem to have lost Chris. I'm not quite sure where he's disappeared to from Engage Consult. So I'm going to go over to Ben at Klinik. Ben, you need to unmute. Thanks. Yeah.
Yeah. Hi, everyone. Yeah, I'd echo the thoughts of the others in terms of encouraging people to go online who might not have the confidence to use the system. It's about educating them about how simple and intuitive these systems are to use, but also in terms of, we are moving a percentage of people away from the phone lines, which frees up the phone lines for those people who don't have access to the internet or don't have the confidence to use the internet. They will get a better service over the phones. And through Klinik, if they're using our total triage solution, they will get the same consistent triage and same consistent data collection as if they were coming through online.
Okay, can I go to Kieran from TPP next?
Hi there. I'm going to pass this one over to my colleague, Dr. John Parry, who you might be able to see.
Hello there. Yes, very briefly. I think we need to go a lot further than this, of course. I think we're in the era now of developing a new clinical contract with patients, and we must be upfront about this. There are those who want to engage in this way, and as we're going to move to more and more long-term condition being managed through these devices, I think we almost need a contract with them. And I think by integrating with the stuff that we have in the clinical record already, we can flag patients as being able to communicate through digital channels and those who cannot. And so we can put in place different channels for those particular patients. So I think it's about being upfront, giving the education that's needed for those to gain the most out of this, making sure we flag the records appropriately, and where we want to use these digital channels, we push it to those who have already agreed to that sort of care.
Thank you. And we've got Chris that's joined us back from Engage Consult.
Yeah, this is one of those glitches. Well, I'm at the risk of sounding like the 2010 election. I agree with Nick. I agree with pretty much everything that Harry and everybody else has said. Really, what we have is we're total triage ready. So that means that you can take a call from a patient who can't use the internet, who doesn't have a mobile, and you can complete a request that goes into the same practice workflow on their behalf. We don't use structured questionnaires in that case. What we do provide is practice configured with concerns and expectations.
Because it's the YouTube channel is where people are asking the questions.
Okay, and then if I can go back to Minal then for the next question, which was submitted by Dave Trisco, who's a fellow PCN director as well.
Yes, and a good friend. So what is your forum for engagement with customers?
So for this time I can go to Lucy again from AccuRx, and you're unmuted.
We love engaging with our customers. We absolutely prioritise user research. We do loads of interviewing, loads of testing. We go and sit in practices and watch people use our products. We also have a world-class support team, so we're available on live chats and email 6 days a week. We're always seeking feedback on our social media channels. And we've also set up for patient triage. We've been setting up webinars for our users to actually share their own learnings with each other. And they've been an absolute smash hit with the users so far.
Awesome. So next I'm going to go back to Harry from AskMyGP, and you're unmuted.
Yes, we have a Slack channel which is very active for our users. We do actually work with practices a lot with their teams. We do support desk, which is telephone, online, directly accessible within the app. And we're getting 20,000 patient feedbacks per week. So patients are important too, and all that feedback is sent straight back to practices for them to act on, and sometimes they go back and talk to patients too. So it's all customers, all types.
Okay, Bala from eConsult, please, and you're unmuted.
Thank you. Yeah. Yeah. Essentially, there's two customers. You've got the patient on one side, and you've also got the clinicians on the other. And actually, there's two different needs really, because I can, on the one hand, see simplicity from the patient, but on the other hand, from a clinician perspective, you need a good level of history in order to really efficiently remotely manage those patients. So we take from both. At the end of every single consultation, the patient's given and offered for feedback. So we collate all that feedback, and that informs our user interface and our product. We also have weekly webinars to gain interest from our clinical community, and that informs our roadmap. And we also have a WhatsApp group as well, which we test ideas as well. So very much a lot of engagement with our clinicians.
Awesome, thank you. Next up, I'm going to go to Chris from Engage Consult.
Yeah, similarly for customers, we have a feedback form that can be completed at the end of a consultation episode. And we get huge numbers of our users completing these. It's nearly 30%. We've actually seen feedback growing over the last year or so. And not only does it come to us, but of course, all our practices can self-serve on their own patient feedback. But in terms of clinicians and managers, well, we've got a range of channels. So we have a very regular program of live training webinars, and also for product feature launches with a practice user group. And we've got a partner practice program where we work with our key partners to develop and test new product features before they go to market. On top of that, we've got a really well-resourced deployment team and a practice engagement manager, and we work quite closely with a lot of practices on a one-to-one basis, both to help them to use the product and use it fully, and also to support them effectively promote the use and benefits of Consult to patients. We have a regular monthly newsletter that goes out as well, and that's very well regarded and widely read. And have a lot of video training also for practices. And we are beginning to develop social media channels to interact more directly with our customer base as well, on Facebook, for example.
Glad to hear a lot of the EGP learners know how much I love my social media channels. I'm going to go next to Ben from Klinik. Thank you.
Yeah, thank you. Hi, everyone again. Yeah, very much the same as everyone else. We have, from a patient perspective, we have a patient feedback at the end of each of the patient's journey. That gives us both a numerical feedback and also some anecdotal feedback that we can leave, or open text feedback. Interestingly, our patient feedback is running at over 90% in the good or excellent range. From a practice point of view, each practice has a dedicated account manager who will support them in terms of their setup, but also support them in terms of any configuration and how to promote the product to patients in the best possible way. We also have multiple user groups, both from a geographical point of view, but also in terms of product as well. So any product developments, any new features, etc., we have a user group where we test and bounce ideas off them too. We also have a partner program where we have our kind of key accounts, where we use them to influence the roadmap, etc., of our product. So very much having both sets of patient customers and healthcare professional customers at the core of our business.
Awesome, thank you. And finally, can I go to Kieran from TPP?
Yeah, sure. So there's obviously two sides to this for us. We've got our GPs, our users who are already using SystmOne, very familiar with our support processes. We have a fully functioning support desk. We have development request screens in SystmOne. We have means to push out notifications to all our users, push out user guides and updates and things like that. So they're already in place and well established. We've also got our account team who can obviously be escalated to if needs be in certain situations. And then from the patient side of things, we've just launched a new forum, AirMid Cares, which is accessible through the AirMid app. And also it's just a regular website really. So that's where we get in, we've got FAQs, we've got videos, we've got training guides. We've also got like a forum so people can ask questions that we'll respond to. And we've also got the capacity if we need to push out notifications directly into the AirMid app. So maybe we could push out a patient satisfaction survey or something like that if we deemed necessary. So there's quite a lot of tools at our disposal for this one.
Awesome. And in addition to that, we've actually also got the SystmOne Facebook user group for clinicians, and I'll have an absolute massive declaration of interest because I run that and also ran the recent SystmOne conference for them as well. I'm going to go back to Minal now, and we're going to go to our final submitted question, which was over to you, Minal.
Sure. So which clinical systems do you currently integrate with, and in brief, how deeply?
So we're going to be really quick on this because I'm aware we've already hit time. So Lucy, go for it.
So we're deeply integrated with SystmOne and EMIS and patient in general as AccuRx, but patient triage specifically will be in the next 2 weeks. We also integrate with the PDS, the spine.
Awesome. Harry from AskMyGP.
Yeah.
Yes, we are on the spine as well, and that's important for patient identification. We have a very simple copy-paste integration with all clinical systems. We are part of GPIT Futures, which is delivering the IM1 interface.
Okay. Bala from eConsult.
Yeah, hi. So we've got integration with TPP SystmOne. We've also got integration with Docman and EMIS via the Docman Connect API, and we're just piloting now in Wales interoperability with Vision directly as well. So those are the 3 systems we provide. We also got NHS app integration and NHS login integration directly, and very shortly we're going to have direct interoperability with EMIS directly into the workflow within EMIS.
Cool. Glad to hear Vision's getting some love as well. Chris from Engage Consult.
Yeah, we have assured desktop application programming interfaces for EMIS Web, SystmOne, Vision, both Aeros and LAN. So we integrate fully with those products.
Great to hear. Ben from Klinik.
Yeah, we have a very simple copy and paste functionality, and interoperability with EMIS and SystmOne is on its way by the end of this year.
Okay, and finally, Kieran from TPP.
Well, as you might imagine, we integrate very well with SystmOne, and then we're currently in the process of going through the IM1 process with EMIS to work with their patient-facing API as well.
Interesting and awesome news. So I'm aware we've already hit time, but I know we've got loads of questions that have come in through the chat. Minal, do you mind just unmuting for a second? Because there's a couple I did want to ask, and I'm going to actually unmute everyone and hope we don't get loads of feedback. So if you do have noise in the background, please try and dim it. And specifically one that I know that has come through numerous times on various forums and things has been my local CCG went through the procurement process with GP Forward View funds a few years ago in terms of looking at providing digital triage systems to practices. I now want to change. What do I do?
Yes, and I think I've written quite a long response, sorry, because YouTube only gives you 200 characters. So I've written about 7 messages responding to that. But in essence, So there will be some contracts in place. As I said, 90% of practices have an online consultation solution in place. So when they come up for re-procurement, commissioners are advised, encouraged, told that they must engage with practices and PCNs. So they must have a role in the decision making around how the national digital first funding is used, and the products that are selected using that, and to really understand what practice and local patient or population needs are, and then to buy the right products. I think we recognise that there isn't a one size fits all, and there's never been a mandate of a one product only per CCG, particularly as CCGs have merged, that population area has also got bigger, and it can be difficult to find a single product that does everything for everyone. So it may be sensible to buy 2 or 3 products, but I think that needs to then be balanced against having a fragmented system, CCGs being able to manage multiple contracts, and also being able to work at scale. So, with PCNs, you'd want to have a similar product range or the same product range, so that staff don't need to learn how to use new products. Your patients don't need to learn how to use the new product. They're familiar with the systems, and you can share workforce and share workload and work at scale collaboratively. Some of the great stuff that we've seen happen during COVID, and build upon that. But it is, you know, local decisions making. You're making the decisions based on local need, but practices and PCNs need to have that voice at the decision-making table. The reason why we don't encourage practices to just directly procure a product themselves is because of the additional risk and responsibility that they take on, that otherwise the commissioner would be taking on their behalf when the commissioner is doing the procurement, particularly around clinical safety risk assessment, IG risk, issues, incidents, contract and supplier management. And we've written some very, very detailed FAQs, really going through lots of these procurement questions. I don't think there's a procurement question that we haven't answered, but if we haven't, then please let us know and we will answer it. And it goes through very transparently the funding, how the procurement decisions should be made, engaging and collaboratively between practices, PCNs, LMCs, patients and commissioners, but also the roles and responsibilities depending on the procurement route that you choose. And also it details the funding. So what happens next, what happens from March, after, you know, April 2021. So it goes through all of that.
Awesome, thank you. Really good answer. And I've been able to put all your comments that you put down in the chat onto the screen as you're going through that as well. I'm going to take a couple more questions from the chat, if that's all right. And I said I wouldn't try this earlier, but we're going to give it a go, just in the interest of time. So Louise Ryan has asked the question of, do any of these platforms actually capture clinical codes? I'm hoping this is a yes or no answer. So if the answer is yes, could the providers please just raise their hand? Hopefully everyone can see that. If not, I'm just going to take the question away. Awesome. And then the next question that we had, which I'm going to have to scroll all the way back down because it's right near the bottom. So question from Sonali. We're seeing more minor illness being submitted through online consultations as patients isn't signposted self-care, pharmacy and other kind of systems. Where are providers looking at, I guess, in terms of supporting practices with signposting patients the right thing? As well as one of the other things I guess I'm going to add into that is moving forward, particularly with network working, we're going to see more outside of practice elements of care. How will the systems adapt to that new model of care? So if I can go to, let's go slightly differently this way. Shall we go in reverse order this time? So TPP, if that's all right.
I think that's absolutely fine. I think that's a really important thing. Part of the content that we'll be putting into AirMid is to include that sort of signposting. And I think in the future also much more detailed signposting into appointment making within whichever organisation you're pointing at. AirMid, of course, will span not only GP, but also community units and acute and other units using SystmOne. So in fact, AirMid can point in multiple directions from that point of view.
Awesome. Next up, can I go to Ben at Klinik? And you will need to unmute your mic, Ben.
Yeah, thank you. Yeah, we are in the process of developing a self-care module, which will point patients who have more benign cases to various different outputs, whether it's some self-care advice via an article, pharmacy, self-referral to a physio, or social prescribing, for example. We're currently monitoring the cases that are going through our system that are benign enough for self-care, and we estimate that safely between 10 and 15% of our cases are suitable for self-care advice.
Awesome. That's not working. Next up, can I go to Chris from Engage Consult?
Yeah, we offer practice configurable self-care advice at the beginning of the journey, at the end of the journey. So practices can point directly to locally relevant self-care advice in response to minor illness. So we have that capability in place. We've always had that capability in place. It is used. It's possibly not used as much as we'd like it to be used. I think part of the consultation process means that a patient has already decided that what they want to do is consult with their practice. People who are self-caring, generally speaking, are self-caring already. but the use is not insignificant. So we offer the capability of people to be able to configure local self-care advice to either meet to be in line with their CCG or their STP. But they can also point to very localized providers as well and put those links in place. It's very simple to do.
Awesome, thank you. Bala from eConsult.
Yeah, so this is always a challenging area. I mean, if you try and automate self-care via disposition, you will inherently build a risk-averse system. And we've seen this with 111, and that's understandable because it's from a clinical sort of safety perspective. So we've very much always given it as an option for patients. And as Chris has already mentioned, patients do select that, but we also accept patients still want to proceed with an online consultation, and can present with some minor illnesses. So we're also working on the other end, and in fact we're working with the NHS to look on how some of these minor illness conditions can be directed safely to a pharmacy, for example, directly, and we're working on a loop to be able to sort of forward eConsults potentially once they've been reviewed directly to the pharmacist, for advice, and then there could be a feedback mechanism back to the practice with the outcome. So that's what we're working on moving forward to help with more of the minor illness stuff that comes through.
Awesome, thank you. Harry from AskMyGP.
Yeah, we put self-care right at the front, and we measure the number of queries. So we know that 20% of users use self-care. And it's all NHS content, but it's very, very tolerant of things like spelling errors and all kinds of words around it. So that's been really successful. On the other question of what about the wider system? Absolutely. And we're already testing our network version, which will allow you to flow the patient request to the appropriate provider within your network. It's not always a GP. It may be linked with your PCN or some other provider in the system.
Awesome. And Lucy from AccuRx, sorry.
Thank you. So yes, we also put a self-care option as one of the first 3 things the patient can do, and we monitor how many patients actually go and use that. Something we're quite interested in is looking at the ability for the practice to customise the patient triage with signposting to local providers of local services. So we're looking into that at the moment. And also our products allow the clinicians to quickly and easily then communicate that with the patient. So sending an SMS with, say, a local physio self-referral form or similar.
Awesome. Thank you. And thank you everybody for your time. So I know we've run over, apologies for that. As I mentioned earlier, if anybody did want any of the more detailed answers that we had, as well as the extra information that the companies have provided, you can access that simply by filling in that feedback questionnaire, which will only take you 2 minutes. I promise you, it's 2 minutes max. And that will feed into further information that I will provide to the providers, as well as to Dr. Minal Bakhai, in terms of some of the hopeful future work we can do in terms of helping you understand digital primary care more effectively moving forward. Thank you everyone for joining us. I know there's loads of comments and questions still in the chat, and apologies, I don't think we're going to be able to get through all of that right now. More than happy we can try and do this again. If you do have any comments or questions, as always, I'm on every single social media channel pretty much going on. I know our providers as well are there, and I also like to thank Minal for offering her time to help support this as well. And as always, we're here to help save you and your patients time by tech enhancing your primary care and learning. Catch you guys soon. And for the locums, we've got a session again on Friday. Catch you then.